would be the most effective under eye treatment? Surgical, non-surgical, and non-invasive? I'm 27 and my under eyes have progressively been getting worse. Dark under eye circles, under eye bags, big blue veins, and puffiness. Makeup does not really help cover it, and people constantly ask if I have black eyes or telling me I look like I haven't slept. I'm getting married in 5 months and would like to see some decent results by then. Thank you.
Thank you for your question. It's very understandable how, at this point, your question is about non-surgical versus surgical solutions and the frustrations you have with both puffiness and bluish veins and other things that you are noticing under your eyes. You've submitted several very, very good photos, and so I can share with you my perspective as a cosmetic oculofacial plastic surgeon practicing for 20 years, how I deal with puffiness under the eyes and the concerns you have, and something about the evolution of our treatment over the past 10-15 years. So let's begin with understanding the anatomy of what is causing the puffiness under your eyes. The puffiness under your eyes is caused by something called lower eyelid fat prolapse. Lower eyelid fat prolapse represents fat that's normally around the eyes that pushes forward and creates a bulge that pushes out and is constantly there. Because it's constantly there, you will typically be perceived as looking tired. 20 years of doing this, the same concern is expressed every day in our practice. Patients who come express how they're tired of being asked if they're tired. Bags under the eyes automatically makes one look like they're older, like they're tired, like they lack energy. So I can tell you there is no non-surgical solution for the level of puffiness you have. Currently, there is an alternative for limited amounts of puffiness where we can use a filler to try to camouflage. But unfortunately, in your situation, the puffiness is significant enough that you would need to undergo a surgical procedure. Now, being in someone in the 20s, most likely that surgical procedure would be something called a transconjunctival blepharoplasty. Transconjunctival blepharoplasty is a procedure where we go to the fat pockets to address them from the inside of the eyelids. And by doing that, there's no external incision. We do this procedure under local anesthesia with light sedation. So that's in real contrast to where a lot of plastic surgeons prefer to do their surgeries under general anesthesia. I've always been an advocate of quick recovery and natural results. So in our practice, this procedure is actually in some ways comparable easily to a less invasive non-invasive procedure where people would just get injectables alone. And I would even argue that the majority of our lower eyelid blepharoplasty patients look better than a lot of people walking around New York City who get injectables under their eyes and have big bruises that last for weeks and weeks and weeks. Now, what we've also been able to evolve in terms of our treatment of the puffiness under the eyes has been a strategy to help skin quality. You see, skin quality under the eyes, fine lines, wrinkling, hollowness, has always been a challenge, and typically it would be a treatment to help the skin quality would be a laser treatment. Now we have microfractional CO2 laser and we use it, but I have been using it more strategically in balance with another method that we do to help skin quality using something called platelet-rich plasma. Platelet-rich plasma is your own blood that is drawn like a regular blood draw for a lab test, and it's spun down. And by spinning it down, we're able to concentrate the platelets, and essentially are the healing growth factors necessary for healing when you get a cut. So what happens is that the skin quality improves because it improves the vascularity, it improves the collagen, it improves the the backbone of the skin. I've been very impressed in our practice when we combine platelet-rich plasma with our blepharoplasty procedures, how well the patients do and how good they look. So that would be a part of the strategy that I would do for someone like yourself. We would do lower eyelid blepharoplasty with platelet-rich plasma concurrently to help with the skin quality. After this is all resolved, you would then decide if you wanted to add some volume in any area that would be strategic, and that's a place where a hyaluronic acid filler like a Restylane, Juvederm would be used, but we do it a little bit differently. We would actually combine it with platelet-rich plasma because we have observed a synergistic benefit where there's more volume correction and more natural tissue growth that is better than either component of PRP or hyaluronic acid on its own. So we have been, we've been at this leading edge of regenerative medicine in other areas of our practice, such as our hair regeneration treatment procedure. So we live at a time where we not only can we help your lower eyelid fat prolapse with a surgical procedure that is quick recovery and safer, but also we can help your skin quality and volumetric loss with new technologies such as platelet-rich plasma and the synergistic effect with hyaluronic acid. I know this is a lot to take in, and at this point it's best that you do some research, find qualified, experienced cosmetic surgeons who you feel comfortable with, and have a consultation, get to know them, feel comfortable, and then move forward with your solution. Since you have a wedding planned, the sooner you do this, the better it is. So I hope that was helpful. I wish you the best of luck, and thank you for your question.